everyone. I am Mr. Brooks. This is your heart test number 3 for biology for Mrs. Bartlow and Mrs. Thomas. Make sure you listen to all the questions carefully. Do not write on the test. It says that in all caps. Alright. Just want to wish you the best of luck. Question number 1. A blood clot that moves from the leg to the shoulder is called, is it B, a stent, C, an embolism, or D, a hemorrhage? Cross off letter A. Question number 2. If you had blood pressure of 122/85, you have blank type blood pressure. Cross off letter C. So do you have A, high, B, low, or D, normal? Number 3, as the heart contracts, it produces what type of pressure? Is it A, diastolic, B, systolic, or D, premature? Number 4, a TIA displays what symptoms that mirror a stroke? You've got to remember here, think about what TIA stands for. Is it A, permanent, B, severe, or D, temporary? Question number 5. Bleeding in the brain is referred to as we're crossing off letter A there, I messed up. C counts. Don't get rid of C, okay? So we're crossing off A. It's all my fault there. So is it B, a brain tumor? Is it C, cerebral hemorrhage? Or D, hypertension? It's either B, C, or D. But C is cerebral hemorrhage. Okay, question number 6. The medical name for a balloon surgery. Medical name for a balloon surgery. Is it B, bypass, B, cardiac catheter, or C, angioplasty? Number 7. The doctor tells you that you need to have triple bypass. During the surgery, he or she will A, take 3 vessels from your leg or chest and sew them around each of the clogs. B, take 3 vessels from your heart and sew them into your brain. C, take a vessel from the arm and add it to the stomach. Or D, take a vessel from the brain and sew it around the heart clog. When a person has a pulmonary embolism, he or she has is it B, a blood clot in the heart, C, a blood clot in the lung, or D, a blood clot in the brain? On number 9, a cerebral vascular accident, a CVA, is known as, is it A, a heart attack, C, a stroke, or D, an aneurysm? Number 10, and what percent of patients with a TIA, 1 aspirin a day, prevents a stroke? Is it A, 39%, B, 2%, or D, 5%? Okay, number 11, when someone has a TIA, he or she has a 50% chance of having a what within a year? Is it a major hemorrhage, B, C, a major stroke, or D, low blood pressure? Okay, number 12, you got old Warren here. He's being rushed to the ER by an ambulance. During the ride in the bus, the paramedic notices that Warren is weak on his left side, and he's unable to speak. What could have happened to Warren? Alright, is it A, crossing off C here, is it A, he had a heart attack, B, he has a pulmonary embolism, or D, he is having a stroke? Number 13. Which of the following is a risk factor of hypertension and a stroke? Is it A, cancer, B, high blood sugar, C, smoking, or D, kidney disease? Okay, number 14. Picture this. You're in a park and you see someone collapse. He or she is alone, so you decide to try and help. He or she is having pain in the jaw, chest pain, and sweating. What is happening to this person? Is it B, he or she has heartburn, C, he or she has a pulmonary embolism, or D, he or she has a heart attack? Question 15. How can a cerebral hemorrhage lead to a stroke? Is it A, a hemorrhage makes more blood go to the brain? B, a hemorrhage causes an interruption of blood to the brain? Or is it C, a hemorrhage never leads to a stroke? And your final question of your heart test. How is an embolism related to a stroke? How are they related? Is it A, an embolism is unrelated to a stroke? C, an embolism causes hypertension? Or is it D, an embolism blocks a vessel in the brain? Okay, hopefully you studied and you did well. Hope you have a great rest of the day. Adios.